Okay, hello and welcome everyone to the Mathematics for Public Health Colloquium. I wish to acknowledge this land on which the Institute operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. The place is still the home of many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. I'll now hand you over to one of our principal investigators, Professor Jian Hongwu.
Thank you, Sarah, and good day for everyone. And I'm very glad to have Dr. Abdou Fofana with us today. Of course, I know Abdou for many years, and it's very great to see him back and to talk at the field seminar. So Dr. Fofana is currently a postdoc associate at the Institute for Health System Innovation Policy in the in the social innovation on drug resistance postdoctoral program at Boston University, and he joined the program and has been working on the social and behavior drivers of South Africa's TB and the drug resistance using the TB patients data and the mathematical model. And he has tremendous results really on the trade-off hypothesis for virulence evolution, especially extended mathematical models to understand the disease spread, and those are highly relevant to the pandemic situations. I'm very glad, Abdou, you are here. Thank you.
Thank you for the introduction. So today I'm going to talk about virulence evolution, and the title of my presentation is Parasite-induced shifts in host movement may explain the transient coexistence of high and low pathogenic disease strains. So this work is part of my PhD thesis that I did at Memorial University of Newfoundland with Amy Herford. So I want to start with a little bit of background information. So parasites, as I will refer to anything that is like virus, bacteria, fungi, protozoa, and worms. I would call them in general parasite in this talk. So these parasites can cause death to their hosts. And that's, if you can measure the severity of the death that the parasite caused to their host, when people measure that, they call it virulence. So for example, the Ebola virus can cause up to 60 to 80% mortality among infected people. So you take all the people who are infected, and then the share of people who die due to the disease within that cohort. So if you can estimate that share, you call it virulence, disease-induced virulence, cause death, sorry. So that's an example for Ebola virus, but other type of parasite like variola virus can cause up to 10% mortality in their host, and others like the common cold virus can cause less to 0.001% mortality into their host. All these three examples are from humans. So as you can see, there are different levels of mortality that parasite cause to their host, depending on the interaction between the parasite and their host. But parasite can also cause non-lethal effects to their hosts. So for example, some parasites can cause sterility. So hepatitis B virus, for example, can cause male infertility in humans, and that can reduce the reproduction of the hosts. Some other virus can cause anemia. The classic example in human population is the malaria human interaction. So the malaria parasite that's caused the parasite that causes malaria in human population, that can cause also anemia. Others can cause reduced host movement, and we have a ton of examples over there. And I highlighted decreased movement here because that will be the focus of my presentation. So that's the reason why when we are defining virulence, we need to take into account the lethal effect, which is death, and the non-lethal effect, which can be sterility anemia, or decreased host movements. I will just linger a little bit on that last one, the reduced host movements that we see in many human parasite interaction. For example, the viruses that are responsible for the flu in human can cause decreased host movements. And that decreased host movement is often referred to as lethargy. So from now on, I will not say decreased host movement due to infection. I will refer to that as lethargy. So it's much shorter, and it conveys the information a little bit more concisely or precisely. So lethargy is a very complex phenomenon to describe. And in the literature, we don't really understand the direct and or the proximate or the ultimate causes of that phenomenon. But what we see is that there are two versions that emerge. The first one is that lethargy can be a direct consequence of parasite replication within the host. And in this presentation, that's the point of view that I'm going to stick with. The second one is that lethargy could be an adaptive defense mechanism of the host to the infection. So in the first case, for example, if the parasite uses the resources of the host for its own replication and transmission, it depletes the resources, and the host is left with very few resources for its activities that improve its fitness. For example, foraging, moving, or defending, running away from predators. You have a lot of other activities that can go into improving the host fitness that is going to be undermined because the parasite is using the host resources for its reproduction and transmission. So the severity of lethargy can affect parasite transmission, as if you have an infected person who is lethargic, that infected person is less likely to make a direct contact with other hosts and transmit the disease. So basically, a parasite that causes severe lethargy to its host is actually causing reduced transmission. And an evolutionary trade-off can emerge between the rate at which a parasite replicates within its host and the rate of lethargy that it causes in the host population, which affects overall virulence evolution. So our goal in this paper was to investigate virulence evolution when parasite cause host lethargy, which is a non-lethal virulence, and host death, which is a lethal virulence. So evolution of virulence when parasites cause host death has received a lot of attention. And the classic example is the transmission virulence, the trade-off hypothesis for the evolution of virulence, where we have a trade-off between transmission and virulence, where virulence here is defined as parasite-induced host death. So that aspect has received a lot of attention during the past 2-3 decades, but host lethargy and in general, non-lethal virulence has received relatively less attention. So that's why here we want to close this gap by combining both lethal virulence and non-lethal virulence and viewing virulence in a very general, have a general definition of virulence and investigate the evolutionary dynamics of a system where you have both lethargy and virulence. So we propose the following epidemiological model, where SM is a susceptible individual. All of our susceptible individual will be at the moving states. And then we have IM, which is the infected population. And those infected people will be at the moving states. And then we have IR, which is also infected people, but they will be at the resting states. They will be at the resting states due to the fact that when they are infected, the replication rate of the parasite within the host causes them to shift from a moving to a resting state. So in our model, we assume that CM, which is the contact rate at the moving states, is higher than the contact rate at the resting state, which is CR, as people who are lethargic will be less likely to make direct contact with other susceptible individual and transmit the disease. We also incorporate some recruitment rates, which is theta, natural mortality rate, which is D, and anyone who is infected can recover at a constant rate gamma. And when you are infected and then you move to the moving states, you shift as the parasite replicate within the host can shift from that moving to a resting state at the rate psi alpha. So this psi alpha here represents parasite-induced host resting rate, which is the rate of lethargy in the host, which is some measure of non-lethal virulence. And then at the resting state, the host can die due to higher replication rate of the parasite within the host, and that is nu alpha. And we call that parasite-induced host mortality rate, which is the lethal form of virulence. So from this diagram, we can write these simple ordinary differential equations with DSM, DT, DIM, DT, and DIR, DT being respectively the variation of the moving susceptible people, the moving infectious people, and the resting infectious people, the dynamics of the moving infectious, the moving susceptible, the moving infectious, and the resting infectious population respectively. And we have alpha, which represent the parasite replication rates, and we're going to focus on that parameter. We're going to investigate the evolution of that parasite replication rate, because that's the parameter. That's the parameter that is going to be linked to parasite-induced host resting rates. So the higher parasite replication rate can cause, for example, higher resting rates, and then a higher parasite replication rate can also cause higher host mortality rates. So we're going to focus on the evolution of alpha, which is going to which we're going to use to predict what non-lethal virulence will be and what the lethal virulence will also be. So to explain this with a diagram, let's assume that we have a chicken, right, infected by a parasite here, which has a lower replication rate alpha within the chicken. So that chicken has a lower chance of becoming lethargic because the replication rate is low. So the rate at which the resources are depleted within the host, within the chicken, that is quite low. And the chicken can, move a lot. So by moving a lot, it has a higher contact rate. But because the within host replication rate is low, that chicken also has a low probability of infection given a contact, because it's not producing enough infectious stages, which will go on to infect other hosts. So also because the replication rate is low, that chicken has a low mortality rate. So now let's look at the case where we have high within host replication rate alpha. You take the chicken, still our chicken, with where the strain or the parasite that's infect that chicken has a higher replication rate. So the higher the replication rate, the higher the likelihood of the chicken becoming lethargic, psi alpha. And because that chicken is burdened by a high replication rate of the parasite, it has a low chance of making a contact with other susceptible chickens. And it has a high mortality rate because of high replication rate within the host, and high probability of infection because of high replication rate still. So the higher the replication rate, the higher the chance of transmission given a contact. So the whole idea here is to say, if we look at all these complex relationship between the replication rate, which has an effect on the rate at which the host becomes lethargic, the replication rate, and the rate at which the host dies due to infection, what is the evolutionary dynamics of this kind of system? So we modified our epidemic model to add a mutant and a resident strain. So we transform our epidemiological model into an evolution model. So the way you do it is just that you add a class that will be a class corresponding to a resident strain, a resident parasite strain, and a mutant parasite strain. So they will have different level of alpha. So alpha 1 will be transmissibility of the resident strain. So the rate of replication within a host of the resident strain, and alpha 2 will be that of the mutant strain. They will have different levels of host resting rates, which is psi alpha 1, and different level of parasite-induced host mortality rate, which is nu alpha 1. So the last thing we did is to assume a trade-off, to assume a link between the replication rate within the host and the rate of lethargy and the rate of mortality due to infection. So we assume a positive relationship between parasite replication rates and the rate of lethargy and the rate of death due to the rate of death, host death due to parasite replication rate within the host. So we assume a simple increase in function here, psi alpha equals to alpha square, and nu alpha equals to b alpha square. So the fraction of host that becomes, the fraction of hosts who become lethargic is defined as rho equals to psi alpha divided by the infectious period at the moving states. And then we have the case fatality ratio, which is the rate of death given that the host made it to the resting states. So which is Q here. So we have our two measures of virulence here. The first one, which is non-lethal virulence, will be rho, and the lethal virulence, which is the case fatality ratio, Q. So we investigated, we performed an epidemiological, we investigated stability analysis of our epidemiological model, and then we performed evolutionary invasion analysis for our evolutionary model. We also performed stochastic simulation, where we take our evolution model, we transform it to a spatially explicit and stochastic simulation for virulence evolution. I can, give more details about those different techniques later. So now the results section. So the epidemiological dynamics, for the epidemiological dynamics, we derive the basic reproduction number of our system. And we see that our system has two equilibria, a disease-free and an endemic equilibrium. And the reproduction number has the following form here, where the red color indicates the quote-unquote reproduction number at the moving states, and the blue color represents the reproductive number in the resting states. So the basic reproduction number is basically the sum of the number of new infections produced by one infectious individual at the moving states, and then the total number of new infections produced by one infectious person in the resting states, provided that that infectious person made it to the resting states. So as R0 is greater than 1, obviously an epidemic will occur, and as R0 is less than 1, the disease will die out. So because we have a population where we have new susceptible people every time, so when the disease occurs, the system reach an endemic equilibrium. So what we are really interested in is the stability of the mutant-free equilibrium, which is the system of ordinary differential equation with the mutants and the resident strain. So we assume that in our population, we have a population that we have a host-parasite interaction that reaches an endemic equilibrium. Then we introduce a rare mutant strain, which has a replication rate that is slightly different from the resident strain in the population. And then we want to know if that rare mutant strain is going to replace the resident strain at the endemic equilibrium. And what our analytical results shows is that the mutant strain alpha 2 replaces the resident strain alpha 1 if this expression R alpha 2 alpha 1, which is the invasion fitness, if this expression is greater than 1. So basically, if the mutant strain has quote unquote a reproduction number or a reproduction number, I don't want to call it reproduction number, but produce more new infections than the resident strain, which is obvious, right? So not only that happens, because you can have a succession of, you have a resident strain which will be replaced by a mutant strain. You can have a succession of competition exclusion. But what you are really interested in is to know what is the parasites within host replication rates that cannot be replaced by any other mutant strain. So we call that an ESS, a parasite strain that cannot be beaten by any other mutant strain. So we call that alpha star here. Alpha star must satisfy certain condition. So we want to be at the local maxima. And then we derive the expression of alpha star, which is this expression here, because our system of ordinary differential equation is quite simple. So you can have an explicit expression of your ESS, which is alpha star here. So to help understand what is going on within the analytical result that I just presented, I want to show the some pairwise invisibility plot, which are graphical representation of the evolutionary dynamics, which is quite simple to visualize how the mutant strain, the competition between the mutant strain and the resident strain. So the graph on the left-hand side here is the pairwise invisibility plot. And the graph on the right-hand side is the corresponding stochastic simulation. Like I explained before, we transform our model into some sort of individual-based model to be able to generate a stochastic version and spatial explicit version of our model. So for the pairwise invisibility plot, on the y-axis, we have the mutant strain alpha 2. On the x-axis, we have the resident strain alpha 1. So every time the color, and what we have in the middle is the expression of the invasion fitness. So I said it before that the invasion fitness is some sort of average number of new infection produced by each strain. We can call it like that. So when you are at this point here, which has on top white and then at the bottom white. So what that means is that if you have a resident strain that is at this level, and then a mutant strain, which has a lower replication rate compared to the resident strain, when it appears in the population, that mutant strain will go extinct until we reach this point here. If that mutant strain starts, if we start our evolutionary dynamics from a place which is really far from the ESS here, so the evolutionary dynamics will drive the evolution of parasite replication rates to this ESS here. And as you can see, on the stochastic simulation, independently of the initial condition, evolution, converge towards a level of ESS that is moderate. So, and in this case, what we assume is that lethargic hosts make no contact at the resting state. I should have said that before. That's the graph that I'm showing here makes the assumption that no transmission is possible in the resting state. Only in the moving state, a parasite can be transmitted. And in that case, a low virulence parasite, which has a low lethargy rate plus a low case mortality rate, will evolve. And that point is not only evolutionarily stable, but it's also convergent stable, because independently of where you start from, evolution will converge towards this ESS. So in the second case, we allow hosts at the lethargic state to make contacts and transmit the disease. But with the contact rate at the resting state being lower than the contact rate in the moving states. So in that case, you have a much complex pairwise invisibility plots. Still on the x-axis, we have the mutant strain, and then on the y-axis, we have the resident strain. So you can see that we have three singular points here. The first one is an ESS. The middle one here is an invisible repeller. And then the top one is also an ESS. So basically we have two ESS which are separated by an invisible repeller. So if the population converge towards this lower level ESS here, if a parasite that's appear in the population that is only slightly different from that resident strain in terms of parasite replication rates, so the evolution will converge, just towards this ESS. But if that parasite has an alpha parasite replication rate that is really different from the resident strain, evolution can converge towards this top higher ESS here, this upper ESS here, which is a strain with high parasite replication rates, high rate of lethargy, and high case fatality ratio. So the first ESS here is a parasite strain that will cause low lethargic rates and then low case fatality rate. Whereas the second ESS here is a parasite strain that will cause high lethargic rates and high mortality rate due to infection. And we confirm this result with our stochastic simulation, where you can see that when you start from a parasite replication rate alpha equals to 0.4 here, you have a first ESS, which is the blue, which is the low ESS here, which is an ESS that corresponds to low parasite-induced lethargy, and then low parasite-induced mortality rates. But because the mutation rate, we set the mutation rate in the stochastic simulation to be quite high, so that the mutants that arise in the population can have a replication rate that is very high, compared to the resident strain. A parasite strain with a higher alpha can evolve and then be maintained. So in this case, you have an evolutionary bistability, which we interpret as the possibility of a transient coexistence of low and high virulent strain. So as long as high mutation rate is possible in the population, and as long as disease transmission is possible in the resting state, so in the with the lethargic infected people, so you have a possibility of coexistence of two strains, one that has low virulence and the other one that has high virulence. So when we did our pair of invisibility plots and our stochastic simulation, we fixed some parameters that also affect the evolutionary dynamics, which is the rate of contact rates, and then the rate of host death. We fix those type of things in order to have a graphical representation, which is simple to interpret. But those different parameters can also affect the evolutionary dynamics. So what we did is that we did some sort of sensitivity analysis, but not really, but we fix everything else, and then we vary the contact rate, and then see how the evolutionary dynamics changes. So on this graph, on the y-axis, we have the case fatality ratio given lethargy, which is lethal virulence, and then host contact rate during lethargy, which is CR. So we still set the contact rate in the resting state being lower than the contact rate in the moving state. But we vary it, we change it such that that increases a little bit compared to the moving states. So when you do that, the first thing that the first interpretation that we can get here is that, so lower CR select for lower virulence. So from 0.1 or even before that to 0 here, we have low level of CR, and that select for evolutionary convergence stable alpha values that are lower. So, and also induce like low lethargy rate and then low parasite-induced, which is death rate. So low non-lethal virulence and low lethal virulence when you have lower parasite value. So one way you can lower the contact rates at the resting state is to isolate infectious people. So when you make the ultimate intervention will be to completely quarantine anyone who is infectious and is lethargic, basically. So that strategy, which is the isolation of infectious people, will select for lower virulence. So higher contact rates, which is when you start from, let's say, 0.1 here to 0.2. So high, in that case, the lethargic host can make a lot more contact than the case that we have before. So higher contact rate can select for high virulence, as you can see it on the graph here. So from 0.2 up to 0.1 case fatality, contact rate during lethargy, we can see that the evolutionary dynamics converge towards a convergent stable alpha value, which corresponds to lower virulence. Higher virulence. So for a range of CR parameter values, which is between, I would say, roughly 0.05 to 0.1, evolutionary bistable equilibrium is possible. And the red dots that you see here are the invisible repeller, and then the the circle that you see here are ESS values. And within that range of parameter value, a low virulence strain and a high virulence strain can coexist, depending on where the epidemiological dynamic, the evolutionary dynamics start from. So the other parameter value that is really determinant for the evolutionary dynamics is a B parameter value here, which is the ratio of host lethargy rate to host death rate. I think it's the opposite, host death rate to host lethargy rate. And we did the same thing here, which is calculating the case fatality ratio, which is lethal virulence, as a function of the ratio of host mortality to lethargy rates. So first of all, when we have higher ratio of host mortality to lethargy rates, so which means we have high mortality rate within people or infected individuals in the resting states, these select for lower virulence, which is the values that we see here from 0.015 to 0.04. So the evolution promotes alpha values or virulence that is lower. And for and then that intervention, is the same as calling lethargic chickens. So I don't want to say humans, but you say chickens, which is a classic intervention that you see in the poultry industry. So in this case, if you have, you can identify lethargic chickens and then call them. So what that means is that you're reducing the ratio of mortality to lethargic. So you select that intervention will select for lower virulence. However, when you have lower B parameter, lower ratio of host mortality to lethargy rates, and a classic example will be imperfect vaccines that prevent death, but do not prevent infection. So those will select for high virulence. So there is a possibility, there is a range of parameter values here where an ESS with high virulence, which is when you go from 0.015 to 0.1, you have a whole range of ESS alpha that correspond to high virulence that are possible here. So to summarize quickly what I just showed from the pairwise invisibility plot up to here, we can say that if lethargic hosts cannot transmit the disease, which correspond to the lethargic host not making a contact at the resting state, low virulence will evolve. So that creates a situation where evolution converges towards a low virulence value, and that level is also convergent stable. So the reason why this happens is that when you look at the expected infections. So the invasion fitness, when you look at the invasion fitness of a strain, the distribution of that invasion fitness in a function of parasite net replication rate. So in the case where disease transmission is not possible in the resting state, there is only one way to maximize the number of new infections that a strain can produce in a population. So that is to transmit most of the infections in the moving state, because in the resting state, transmission is not possible. So basically, the parasite that will be able to be transmitted sufficiently in the moving state will be the one that will be selected in the population. But you cannot also have a very low replication rate, because in that case, of course, the host will move and transmit the disease, but the replication rate of the parasite is so low that the disease is not transmitted. So only in the moving states that you can optimize the expected number of new infections. So in the case where transmission is possible in the resting and in the moving states, we have two local maxima here. The first one, which corresponds to a low virulence, and the second one, which corresponds to a high virulence, which is parasite net replication here. And then for the low virulence, most of the infections, of course, are transmitted in the moving state, and then few of them are transmitted in the resting state. But for the second local maximum, most of the infections are transmitted in the resting states, where the parasite replication rate is much higher. So even with few contacts, it's highly likely that those contacts will lead to new infections. So because of high replication rates. So it seems like the expected number of new infections are kind of distributed between the moving and the resting states. And you can either optimize your transmission rate in the moving state or optimize it in the resting state. So the parasites with low virulence optimize their transmission rate in the moving state, and the parasites with high virulence will optimize their transmission rate in the resting states. So I will add one last example here, which I haven't discussed in the results section, but which is worth mentioning, is what about the case where the host death due to infection is negligible? And in that case, we have, for example, human rhinoviruses in human population. We know that they have negligible death rates. What happens when you change your evolutionary dynamics and then you say, okay, we only need non-lethal virulence. The parasite doesn't induce lethal virulence, so death due to infection. So the evolutionary dynamics is driven by the cause of lethargy in that case. As shown on this pairwise invisibility plot here, you can clearly see that the upper virulence, the upper level of virulence, the upper value that we were seeing here disappears or doesn't exist anymore. So what this does is that if you have that case, you can have ever increasing alpha value because there is no way to limit evolution towards high virulence. In the previous case, the way to limit evolution towards ever increasing virulence is having a mortality cost, whereby a higher replication rate of the parasite lead to early death of the hosts. But in this case, because death doesn't exist, death is not an option. So the evolutionary dynamics will select of ever increasing virulence in the case where we don't have death rate here. So now the question is, for all these theoretical presentation, can we in some way find a real life example of this type of dynamics? So we think, or we speculated that the avian influenza virus can be an example where this situation can occur. So the avian influenza virus is a type A influenza virus. So that the host is in domestic poultry and wild bird populations. So the transmission mode is via direct contact and fecal oral routes. So the disease manifestation is often, as described in the literature, involve lethargy and mortality. So we have a huge number of subtype in this group. Example, the H5N1. So this is a type of avian influenza virus that I'm giving here. I think a lot of people know this strain. So, and in avian influenza virus, it's reported in the literature that we often have a low pathogenic strain, LPAI. So in that case, you have lethargy, which is manifested like 7 days post-infection, and 5 to 10% mortality in chickens. And then you also have a different strain that is a highly pathogenic strain, which in which we see lethargic within 3 days post-infection, and sometimes 100% mortality in chicken. So the hypothesis about the coexistence of those two strains, the different hypotheses that we see in the literature, is that the evolution of of pathogenic avian influenza viruses comes from the introduction infection spillover, which is the introduction in the population of a highly virulent strain, of highly pathogenic strains. Okay, you have a population where the circulating strain is a highly pathogenic strain, and then the highly pathogenic strain gets introduced in the population, and we see that an epidemic of highly pathogenic influenza viruses. The second hypothesis is the mutation hypothesis, which is that we already have a low circulating strain, and then because mutation is really high in that population, the emergence of a highly pathogenic strain from a low pathogenic strain is highly likely, and that causes the epidemic of highly pathogenic strains. So what's our model predict or can add to that is that as long as lethargic chicken make contacts, a highly pathogenic avian influenza virus will evolve no matter what its origin is, whether it's from spillover or from a mutation of an already circulating low pathogenic strain. So as long as contacts is possible in the lethargic strain, a highly pathogenic avian influenza virus can invade the population and cause an epidemic. So the second thing is that if you can limit the contact or the transmission of the parasite in the lethargic states, which will correspond to targeted quarantine, like if you can identify the chickens that are lethargic and then quarantine them, if that's possible, that can prevent the evolution of high virulent strain, whether it comes from introduced origin or circulating in the parasite population. As long as the lethargic chicken cannot transmit the disease, evolution towards high virulence is not possible. The other one is targeted culling. If you can induce high mortality rates in lethargic chicken to prevent them from transmitting the disease, of course, you can also prevent the evolution of high virulence strain, because the high virulence strain, basically, its transmission is, or its fitness, it optimized at the resting state. If you can limit its rate of transmission there, you definitely limit its evolution in the population. So thank you so much for your attention. So I'll be really happy to answer any question and to clarify any points that I didn't explain properly. Thank you.
Thank you. Any questions